In Paris, the Food and Drug Administration warns the Johnson & Johnson coronavirus vaccine could lead to an increased risk of a rare autoimmune disorder. This as debate rages over whether or not people should be getting a booster shot of the Pfizer vaccine. And the Centers for Disease Control and Prevention puts out new guidance for schools that calls for a full reopening. Joining us to break down the latest COVID news is Dr. Susan Bleasdale, Medical Director of Infection Prevention and Control at University of Illinois Health. Dr. Bleasdale specializes in diagnosing and treating infections. And Dr. Bleasdale, welcome back to Chicago tonight. So, as we just mentioned, the Food and Drug Administration has issued this warning about the Johnson & Johnson vaccine being linked to this rare neurological condition. What do we know about this?
So, we had some preliminary information that we're going to get more formal details in the coming days, but there appears to be some cases that are associated with the Johnson & Johnson or Janssen vaccine, that's the same vaccine, with this rare condition. It's called Guillain-Barré. It's an immune response that typically happens actually after infections, primarily stomach and gastrointestinal tract infections and respiratory infections. So it is something that can happen with the kind of a faulty immune response in response to an infection, and rarely has been associated with some vaccinations in the past. And so there is a signal that suggests that this may be related to the Johnson & Johnson vaccine. However, we'll get more details on the confirmation of that data in the coming days.
Now, the rollout of the Johnson & Johnson vaccine in particular has been a bit bumpy. What do people need to know when they're deciding whether or not that's the vaccine they want to try to access?
Right. I think, the important thing is to be aware of the data that's out there. There has been some bumps as the Johnson & Johnson vaccine was rolled out. There was some concerns about one of the manufacturing sites. That was addressed very quickly, and I think that overall that's not an ongoing concern. There was previously some concern about the Johnson & Johnson vaccine with this potential risk for, again, sort of an immune-mediated response that caused a clotting disorder. The numbers were very low, but to be aware that this is a very small but rare risk and may be associated, it was reviewed and was quickly reinstated, and we continue to give this vaccine just with some information about this potential risk because there wasn't a definitive association. This is the same thing right now that we're seeing. This syndrome of this potential weakness caused by the immune system may be related to Johnson & Johnson, but also we see some cases of this every year. And there's about 100 cases that have been identified associated with the Johnson & Johnson vaccine right now. But we typically see in the several thousands every year from various reasons. So we'll get some more information. So as you're making a decision about Johnson & Johnson, it's just knowing what that's there, talking with your doctor about it, deciding, is this the right vaccine for me? What's happening in my community? Is there a benefit of a 1-dose vaccine versus the other 2 candidates available that are a 2-dose vaccine to help to make that decision about using the Johnson & Johnson vaccine for you?
Now, the daily average of COVID cases, it's back on the rise. And on top of that, we know Chicago's positivity rate, it's escalating again as well. This time last month, the rate was 0.6% positivity rate. Now it's up to 1.1%. What do we know about driving this increase both here but nationally?
Probably what we're seeing nationally, the overall increase in the number of cases is primarily fueled by the Delta variant, right? This is what we're seeing. It's becoming more prominent. And you can see pockets across the United States, in particular in regions and areas where there is much less acceptance of vaccination. Unfortunately, we're seeing more cases, and then there is just more spread within that community. And so it's really important that in light of this information around Johnson & Johnson, that we are still working towards getting as many people vaccinated with the candidate vaccines that we have currently, because there is data that the vaccines do provide protection against the Delta variant and will decrease your risk of hospitalization and death. And that's really important, as in some areas where there is significant transmission, they are seeing increases in hospitalizations and deaths.
Now,
we're not seeing that in Chicago, though, thankfully.
Dr. Anthony Fauci, he spoke last night about the possibility of a booster shot. Here's what he said.
Given the data and the information we have, we do not need to give people a 3rd shot, a boost. superimposed upon the 2 doses you get with the mRNA and the 1 dose you get with J&J. But that doesn't mean we stop there. They continue. I mean, there are studies being done now, ongoing as we speak, about looking at the feasibility about if and when we should be boosting people.
It was Dr. Fauci yesterday morning, I should say, but there is confusion about whether or not a booster will be needed, as companies like Pfizer are planning to seek approval for an additional shot. Why is this a debate, Dr. Bleasdale?
Well, I think it's confusing because you're hearing different things as Pfizer is proposing this booster. But I would say, as Dr. Fauci has outlined, we have some data right now that shows that there may be some evidence of long-term immunity. Actually, the data is based on the Pfizer vaccine and is likely also applicable to the Moderna vaccine, as they're the same mechanism. And then right now there has been some concern is that, especially in Israel, where they had a very large number of people vaccinated, and they're in the midst of an increase in cases related to the Delta variant, that they're seeing some increased cases. However, it should be highlighted that the preliminary data suggests that those that are having symptomatic disease that are fully vaccinated with the Delta variant are not having as severe disease. And so the vaccine may not be as fully effective for
but it
the
certainly
Delta variant versus others.
Sounds like it lessens, obviously, the opportunity that someone would be severely sick. Really quick before we let you go, Dr. Bleasdale, new guidance on schools. In a few seconds, what do schools need to be thinking about as we get towards reopening?
Priority is getting our kids back in classes and that we can do it safely. We have data that we've been able to do it in certain pockets throughout the country over the last year. We know vaccine works. That's the really primary goal, get as many people vaccinated that are of age. And those that can't, we use multiple strategies, masking, 3 feet of distance whenever we can, working on testing strategies to help to minimize transmission, and keeping our hand washing and staying home if we're sick. And that'll help us get our kids back in school.
Keep it clean, of course, for students. Thanks so much, Dr. Susan Bleasdale, as always.
Thank you.